What is palliative care? If there was ever a medical specialty that's so clouded in myths and misconceptions, it may be palliative care. Now, there are other specialties where people are not sure exactly what's going to happen. But time and time again, when we sit with patients, patients are a little bit fearful, a little bit troubled that we're meeting this new doctor, a palliative care specialist or a nurse, and they're on tenterhooks. So a lot of our first discussion is calming people down. And the way I say it is, Mr. Jones, if there was one word to describe what we're going to do for you, is comfort. Comfort not only physically, but emotionally and spiritually for you. Not only for you, but your family with what you're going through. Technically, if you like, palliative care is the specialty, if you like, or the discipline of medicine and nursing, and also a lot of allied health are involved. That's the care of patients with serious life-limiting illnesses. There are a couple of myths immediately we're putting to one side. Myth number one, palliative care is all to do with cancer patients. I didn't mention the word cancer, did I? All life-threatening illnesses, end-stage heart disease, lung disease, motor neurone disease, end-stage dementia, end-stage renal disease, and cancer, of course. Two, the other myth is that palliative care is simply for dying patients. Palliative care is not just terminal care. It is involved in terminal care, of course, but it's not simply terminal care. Palliative care is more than simply pain management. You've heard my definition of the breadth of that. Now, no one health professional can do all of that, so there's a big emphasis on a multidisciplinary approach to palliative care. Doctor, nurse, physiotherapist, occupational therapist, pastoral care in terms of counselling. Many people involved in this. The presence of palliative care can be in hospitals, hospices and hospices. We have hospices in this area and around, but not in every area, which are dedicated to this work, and also home care. One of the myths I hear that, palliative care won't be able to help the person at home. No, palliative care, certainly throughout this metropolitan area and in many areas, they have entire teams dedicated to providing home-based palliative care. But perhaps more than the clarity of any academic definition, one of the great, perhaps, senses of palliative care came from not a health professional, but a poet. Bruce Daw, one of the great Australian poets, wrote this poem in 2007. Whitewater rafting and palliative care for my late wife Gloria. If I had understood when down the river you and I went swirling in that boat, that there were those who knew the ways of water and how to use the oars to keep afloat, I might have been less deafened by the worry, less stunned by thoughts of what lay up ahead, the rocks, the darkness threatening to capsize daily. If I had only realised instead that help was all around me for the asking. I never asked, and therefore never knew, that such additional comfort could have helped me, in turn, to be more help in comforting you. I would have found it easier then to simply hold you, instead of bobbing to and fro so much, for it was you who seemed to be more tranquil, and I whom death was reaching out to touch. If I had only had sufficient knowledge in that whitewater rafting, I'd have learned that there are those around us with life jackets to whom I might have in that turmoil turned. Instead, because I had not thought of rivers, or rocks, or rapids, and gave way to fears that seeking help might make a man less manly and liable to betray himself with tears, I was less useful then, as twilight deepened, than I might well have been, had I but known, however wild the waves that roll around us, no one needs to live or die alone. It's a wonderful poem, isn't it? The language, the clarity, the extraordinary metaphor he's using of serious illness, of people suddenly hearing an abrupt news that you have a life-limiting illness, that things are irrevocably changed, that in some way you have lost control. And I love the fact that it's not just Gloria, the patient in the boat, it's both Gloria and Bruce together in that boat. Families dealing with this in conjunction. And also the sense of great regret that comes through that poem. If I had but known, there might have been things that might have helped me through that. And we do hear that occasionally when patients come to us almost washed up onto the shore, saying, for 6 months we've been looking for someone who was really going to try and address our symptoms. We didn't think this would ever end. And it is only natural, as a human being, when things are like that you want it to stop, that you reach for a cessation. What is the difference then between palliative care and euthanasia? Palliative care, as I've just explained, is a concentrated, focused attention on these issues of suffering, not just the physical but the emotional and the spiritual. Euthanasia, or physician-assisted suicide, is obliterative, so that there's a fundamental difference in the approach here. What happens when John and patients like that ask me as a palliative care specialist questions like, I know I shouldn't be asking this. I know what your answer is going to be, doctor, but I want a needle. I want this to end. To me, I don't judge. None of us should. I don't become appalled. I don't stand back and close the discussion. I don't answer by saying, it's illegal, we cannot talk about this. I don't do this. To me, and I think most of my colleagues here, and I have a colleague in the audience, would welcome that question, because what it does is opens up the entire discussion. What is it that troubles you most? What is it that you're fearing about this illness? How are you going with this illness? Why is it that you are so troubled? And with that is an enormous, rich welling up of a discussion about what we can do. The answer maybe surprises us. Sometimes it can be because of this shocking pain, but others it can be, I'm comfortable now, but I know I'm going to feel pain towards the end. That's how my father died. This is how people start to talk. The other issue can be, so it can be fear, it can be issues about now, it can be issues about the future. The other issue is, it may be that the patient has a major depression, and that needs to be addressed as meticulously as we do with pain. The other issue may be, but look at me, I am losing everything. I was independent, I could do things, I could go and fish, I could go and walk, I could do things in my garden. I can't do this now, I'm too weak, I am losing my dignity. These are deep issues, and these need to be acknowledged and talked through. The issue of dignity for all of us as human beings is absolutely pivotal. And we often hear in the euthanasia debate, when a person has lost all dignity, then it is time. Or death with dignity. Dignity is complex, and it's not for me to talk about this in depth here. But in essence, there's the extrinsic dignity, the dignity of a person who is able-bodied and able to do things, who has an appetite, who has energy, who is able to stay awake.